Thank you everyone for joining and for being with us today in this session. Thank you for our speakers to be able to present the experience they would like to share. I would make a short introduction in what is the NGO involvement in the Republic of Moldova when has been started. And after that, Tatiana will present the speakers, we'll have the presentations, and after we'll have the Q&A session. I kindly ask the attendees to send their questions in the specially dedicated box for Q&A. In case you have such, and we'll take all the questions at the end. If your question is addressed to a specific panelist, please indicate the panelist to whom your question is addressed. As you see, as you know, Republic of Moldova is a post-Soviet Union country in which TB is a problem, and as in other former Soviet Union countries, the health and social service delivery in Moldova were state-centered, and the community groups had little role to play. For the initial involvement of the CSOs, we had the organization Carlux, now is renamed Act for Involvement, which was one of the first involved in TB care delivery for addressing TB in prisons in early 2000s. And also we had, as one of the community partners involved in TB control in Moldova, the organization Speranța Teri. More TB community organizations emerged starting with 2010 as service providers of the community-based delivery and in advocacy mobilization, with the efforts that were put in the Global Fund round 9 of the TB grant, together with the country partners, the NTP, the Central for Health Policies and Studies as principal recipient of that grant, and also of the Soros Foundation, who was responsible for the component involving the civil society. In this context, with the Global Fund support, we had 10 NGOs that have been engaged in the community-based delivery for patient adherence and peer support. Those 10 NGOs created in 2013 an NGO platform of civil society organizations in order to strengthen the joint efforts in the fight against tuberculosis in Moldova. During even the role of the civil society in TB control was always acknowledged in Moldova, and we as civil society partners always had a very good collaborative relationship with the NTP, with the service providers, with the TB staff in districts during the COVID times and during the COVID restrictions that were put in place starting with March 2020. The role of involving the civil society and helping the frontliners was more obvious and requested. So in this context, as the case notification was directly impacted by COVID. TB case notification was directly impacted by COVID overall in the world and in the region, and Moldova is not an exception for this. we, at the country level, together with the NTP and together with the civil society organizations, decided to address some of the barriers in accessing the services for diagnostic for the most vulnerable populations through involving the civil society organizations in the active case finding. About this, my colleagues and our speakers today will talk in details, and I would invite Tatiana now to present the speakers and introduce, and the speakers introduce themselves, say a few words about what they are doing, and after that we'll proceed to the presentation. Thank you.
Thank you, Christina. Good evening to one and all present here. I am pleased to introduce the speakers of this session on Community Connect. The first will be Lucia Pârțână, Program Coordinator at the PAS Center, Center for Health Policies and Studies. Lucia coordinates the Global Fund grant in strengthening tuberculosis control in Republic of Moldova, PAS Center being one of two principal recipients of Global Fund grant. Lucia will present the quick overview of Moldova's experience in addressing the barriers to timely TB diagnostic for the most vulnerable populations. First, the representatives of various non-governmental organizations will share their experience in working with specific groups of key populations in order to identify new cases of tuberculosis among them. Oksana Rukshineanu represents the Moldova National Association of TB Patients, SMIT. This organization represents TB patients at the public level by making the voices of TB affected populations heard and use personal TB experience as a key motivational caring approach to people in treatment. Oksana will speak about civil society organizations' experience in strengthening the active case funding in Moldova. After that, we'll take the floor Ala Iacco, the Director of Union for HIV Prevention and Harm Reduction. WARN is an umbrella structure which brings together civil societies implementing harm reduction strategy in Republic of Moldova. They work with key populations as drug users, sex workers, people living with HIV, and patients with tuberculosis. Today, Ala will present the experience in strengthening the active case funding among people who use drugs in Bălți municipality. The next will be Lilian Severin, Director of Non-Governmental Organization Act for Involvement. AFI is working to ensure access to healthcare services for vulnerable persons affected by tuberculosis, by HIV, or other diseases with a social impact. In this session, Lilian will share the experience in strengthening the active case funding among homeless persons in Chișinău municipality. And I propose to start the presentation. Lucia, you have the floor, please. I share now the presentation and Lucia, please,
I don't see the slides, Tatiana.
Tatiana, we cannot see the slides.
You don't, excuse me. One moment. Now you see?
Yes, full screen, please.
Yes, can you put the full screen?
Yes. Okay.
And go to the fourth slide, please, Tatiana. Next. Thank you. Thank you so much, Tatiana. Hello to everyone. Just a few words about PAS Center. The Center for Health Policies and Studies is a Moldovan-based, independent, non-commercial organization focusing on public health programs related to health and community systems, TB, HIV and hepatitis, drug use and non-communicable diseases, and social accountability in Moldova and Eastern Europe and Central Asia region. Our mission is to build democratic societies through improvement and development of health and social sectors, policy advocacy, capacity buildings, and reform support. Working in a participatory manner with the communities since its creation, it is more focused starting from 27 on small grants to CSOs, advocates and providers of innovative people-centered approaches for HIV and TB in key populations, on bridge and alliance builder to connect CSOs with CCM's national TB programs, governments, parliamentaries, as the global TB caucuses, WHO country and regional offices in the Eastern Europe and Central Asia region, on sustainability work related to contracting CSOs, on community-led monitoring and use of digital technology to engage people affected by TB as co-creators of quality of care in Azerbaijan, Kyrgyzstan, Belarus, Ukraine, Kazakhstan, on conducting CSO-led CRG assessment in Georgia, Kazakhstan, Armenia, and Moldova to follow, on meaningful engagement of communities and civil society in ensuring quality TB care via strengthening community advocacy role, operational capacity building, bridging the gap between civil society and state health services, bottom-up advocacy and promotion of people-centered model of care, and on CSO capacity building for demand generation for new diagnostic technologies and new treatment regimens. Next slide, please, Tatiana. Oh, I can myself. About the current situation in the Republic of Moldova, the Republic of Moldova is the country with the high priorities in TB control in the European region. At the national level, tuberculosis remains one of the core public health problems, the country being among 30 countries with a high burden of multi-drug resistant TB in the world. Next slide. Thank you. The achievements of the Republic of Moldova in TB control in the last decades have been remarkable. There has been a tendency to stabilize the epidemiological TB situation in the recent years. The statistics of the past years have shown an improvement in epidemiological indicators as a result of the provision of person-centered TB care, prevention, detection, treatment. During 2019, there were 2,879 new tuberculosis cases and recurrences, which determined a rate of 71.7 per 100,000 population for the incidence, with a reduction of 4.5% from 2018 and of 20.2% from 2015. Next. But disruptions in services caused by the COVID-19 pandemic, reallocation of human, financial, and other resources from TB to the COVID-19 response impacted data collection and reporting systems, have contributed to a significant reduction in TB case notifications in 2020, with 37.7% drops reported compared to the same 9-month period in 2019. This reduction in case notifications could lead to a dramatic increase in additional TB death. Next. The main challenges caused by the COVID-19 pandemic from the community perspective are acute need in food support and basic needs for people living with HIV and people affected by TB during lockdown, outreach to homeless and in prison during quarantine, shortage of personal protective equipment and mobility, decreased community-based HIV and TB screening and case fundings. Telework reduces participation and advocacy, disruptions of face-to-face activities and planned activities. And for health system perspective, decreased access to health services, X-ray overload due to COVID-19, stockouts of methadone and buprenorphine, remote and digital work not fully accessible to all beneficiaries, and combination of COVID-19 and reform had a negative impact on people affected by TB. Next. In order to mitigate the impact of COVID-19 on essential TB services, in collaboration with NTP and CSOs, we have implemented a number of measures, such as expanding the use of digital technologies to provide remote advice and support, reducing the need for visit to healthcare facilities, providing TB treatment and adequate supply of drugs at home, and increasing the role and the involvement of CSOs. Next. I just want to emphasize the role of CSOs in TB care. They have direct access to vulnerable key groups. They refer to the diagnosis and support during treatment, support people with TB until treatment is complete, contribute to the reduction of stigma and discrimination, create partnerships between stakeholders, participate in health policy development and planning, get involved in promoting and contributing to comprehensive TB care, participate in the program intervention, measure, implementation, monitoring, and evaluation. Next. Taking into consideration all above mentioned, in order to improve TB case notification by CSO's involvement, the National TB Program and civil society have joined forces to ensure that essential services for both TB and COVID-19 are maintained for those in the need. We have identified funds to engage CSOs in TB detection, savings for Global Fund grant. We developed the guidelines for CSOs and involved 7 CSOs in active case funding. We identified territories based on epidemiological indicators. The Ministry of Health and Social Protection issued an order on organizing active TB detection, and we planned to cover 1,200 people with diabetes, people with drug and alcohol addiction, people with post-TB sequelae, contacts with people with TB, people living with HIV, and we started in October. The preliminary data as of October 15 are 880 people radiologically investigated, 22 suspected cases of TB, 2.5%, 10 cases of TB detected, 1%, 110 cases of post-tuberculosis sequelae, 12.5%, and other diseases. For cases of pulmonary fibrosis, 5 cases of pneumonia, 2 cases of pleurisy, 3 suspected cases of COVID-19, 2 cases of lung cancer, and 2 cases of cardiomegaly. Thank you so much. My colleagues will continue to tell you about the ways of working in the territories, the collaboration with the local partners, the good practices, and the lessons learned.
Thank you, Lucia. The next speaker is Oksana Rukshineanu. Please, Oksana.
Thank you, Tatiana. Thank you, Lucia, for a great presentation and bringing an insight from the general for people to understand the general situation in the Republic of Moldova and the engagement of civil society in doing different good things for building strong national TB responses in the country. I represent a TB patient organization, actually being MDR survivor myself, finishing treatment in 2010, together with my colleagues, I would say my friends in the disease. We founded our organizations in order to make the voices of TB affected people, and not only TB people as patients, but as well their families, to be heard at while building the national TB response. Next slide, please, Tatiana. As Tatiana mentioned in the beginning, our actual mission and how we are constructing our activity in the organization is actually use the personal TB experience as a key motivational caring approach to people and treatment, because we do acknowledge that sometimes people that go through the disease bring their personal perspective, their personal understanding, and sometimes highlighting the needs and barriers that people in treatment or people accessing the diagnosis services in the country face. As well, we understand that peer approach is one of the best way to connect people to services. One of our objective, as well as being active in building partnership, we acknowledge that cooperation between research people, academia, medical profession, as primary healthcare and TB services, and not necessarily just TB services, but many other services. Of course, we put a big focus on people who are making decisions at different levels. We're speaking about local public authorities and, of course, the community, because we do want to construct a good partnership to improve TB people's health and make process of treatment and the process of diagnosis more efficient by strengthening responsibility and improving social, psychological, legal, and material, and whatever different support people need in accessing services. As acknowledging the importance of stigma-related barriers in the country, and not only in Moldova, but as well in the region, we acknowledge that it's important to focus on human issues related to human rights. We try and we are doing our best to represent TB patients at different public levels, starting from the community level in the villages and ending with the level of the ministry, engaging actively in different technical working groups within the Ministry of Health and Social Protection. As well, we understand that to make changes, it's absolutely important and crucial to be aware about the decision processes. That's why we do participate together with our community and civil society organization in Moldova in all possible decision-making processes. As just a glimpse to our quantitative data, I would say that we managed during starting with 2011 and until now to bring the knowledge about TB symptoms and inform, sensibilize the community about tuberculosis. Of course, we try to do the same among the people who make decisions. And we talk much with representatives of primary health care, local public authorities. And of course, we acknowledge that the best issue to change the attitude is to work starting with children, because it's very difficult to change the opinions when we are speaking about stigma and discrimination in adults. But I think the best way is to start with kids in kindergartens and in the primary health, in primary schools. Next slide, please.
Oksana, sorry for interrupting. I have a kind request to you. If you can speak louder or be closer to the microphone, because the attendees are writing that they are here not very well. Yeah.
I'm so sorry.
If you, yeah.
I will try to speak louder.
Okay, thank you.
Thank you so much for letting me know. I would like just to highlight that we managed during one of our projects in the last year to make an assessment, and I would like just to bring to your attention how important it is to understand patients' experience and expectation while building national TB response. In this context, I would highlight the importance of making this kind of assessments by engaging peers and trying to understand and bring the perceptions of people and families who are affected by TB to a larger audience. The results of our assessment done back 2 years ago showed actually that it's absolutely necessary to adopt a community-based treatment and support model that provides people with options that allow treatment. And I would say not only treatment, but as well diagnosis to better fit their lives. People with TB, and we should acknowledge, people with TB should be made aware of all possible and existing ways of accessing treatment and support in their communities. Patient's family, and we all know who are working at the community level, patient's family do play an absolutely great and crucial role in the patient's adherence to TB treatment. For this, we would encourage the case management, and in many community centers which are functioning in Moldova, a needs assessment is done, and it should be done to determine the best approach in terms of economic, social, and psychological support for people with TB and their families. One of the issues patients face during treatment is, of course, adverse reaction. Sometimes not tackling in time the adverse reactions will lead to treatment disruption. We understand that medicines to treat the adverse events should be available free of charge, regardless of whether a person is in the hospital or in ambulatory, in outpatient. We do promote the idea that people with TB have a right to privacy, and this should be acknowledged and respected fully. But still, with the patient's consent, we should do absolutely all the necessary counseling interventions to educate and to bring peace in the minds of our TB affected people. Another challenge is of course, and I would highlight that this is becoming more important during COVID pandemic, is the lack of time. And this is the challenge patients are facing. They do want more time with medical staff, and I would say not only medical staff, with social assistants and different representatives to speak. In this situation, we are facing the adopting different models, and telecommunication is becoming increasingly important for people affected by TB. Next slide, please. In a few words, I would like to say that the active case finding has been accepted as one of the major or pillar intervention in TB care and control. Therefore, just a few words about an experience civil society had due to the Global Fund resources and, of course, of the support of the National TB program in active case finding. We actually managed to bring and to write an article with the National TB program coordinator and with the support of the sub-recipients, and submit to the WHO Europe to introduce this experience as a best practice in the compendium of good practices in the implementation of the tuberculosis action plan 2016, 2020. As in short, just to say that almost 2% of people who've been examined have been detected with TB, and we think that this is absolutely crucial to be able to continue this activity and to give possibility for civil society to increase their active involvement in case finding and of course to contribute to building partnership among every important stakeholders at the community level. Next slide, please. As to speak specifically about our experience in 2017 within this project that I have spoken just a few moments ago, it's actually highlighted very interesting challenges that we had. Beyond the fact that it was a very short intervention in a way, we were supposed to, during 4 months of activity, to bring people to X-ray and try to find people who are affected and still undiagnosed with TB, to bring them to services. We understand that actually one of the challenges, and not only one of the, let's say, less important, is of course low interest at that moment, because the situation of course has changed now. But at that moment we had low interest of local public authorities for TB, and which is partially explained by the lack of a budget line for health, because we've been asking them to contribute, while technically local public authorities did not have any tool to be able to financially contribute to examination of people from the different high-risk groups. Unfortunately, even we are in an era of technologies and information is all aware available. It's still stakeholders at the community level lack knowledge about TB. And when we're speaking about primary healthcare, unfortunately, many primary healthcare representatives lack knowledge about new innovations, about new trends in TB care, about new medicines, and this is, of course, is a challenge. We have acknowledged that at that moment, limited motivation for primary health care to be engaged in TB. What was one of the structural challenges, of course, a lack of common vision, like a normative tool or a document which is available for both primary health care and local public authorities to get together in a national response in active case finding at a community level. Another challenge was, of course, a lack of connection between, which varies from lack of connection and poor communication between services. We're speaking about primary health care, X-ray services, and local public authorities. And one of the biggest challenge was, of course, the delays in confirmation, because actually bringing people to the diagnosis and making the X-ray is only the first step. There is still many more services, many more tests which should be done to be confirmed of TB. At the moment of ending of our project, 4 months period, out of 16 people which have been confirmed of TB, only 7 at that moment were enrolled. And this brings the challenge of unfortunate delays in enrollment in treatment. Next slide, please. What we're doing right now? Right now we are in the same situation with another 7 organizations which are working throughout the country and trying to bring their own contribution in active case finding in the country. We understand that maintaining the most critical services, and of course that's the motto of our national TB program, is that's absolutely crucial, especially detection and treatment of TB. And the COVID pandemics just highlights how important it is to get mobilized in a short time, to be able to identify resources and to be able um, to do all the necessary, but the process starts to do interventions in a short term. This is what we managed together with the National TB program, and I'm very proud of this, because the disposition that has been issued at the end of July is actually, when we are looking deeply in the document, is actually a standard operational procedure for detection, and it has very good parallel of the interventions for detecting the TB and as well for detecting COVID. And that's an absolutely good instrument, as well as for civil society, who are mentioned in this disposition, and of course primary health care, which is one of the main stakeholder in this process of detecting TB at the community level. We are working right now, and that's almost for 3 weeks, starting with October, in two rayons, which are different. One is smaller, the next one is twice as big as the first one, but the disposition that has been written very carefully and issued by the Ministry of Health is actually a very good tool for us as civil society to use and mobilize primary health care even in this difficult situation. We managed, as for now, to bring to X-ray almost 200 people, and out of these 200 people, we already have 4 confirmed TB cases. Unfortunately, TB is not the only disease that we are detecting. We have as well cancer diseases, and this is another issue for the Republic of Moldova. Next slide, please. Just to say that actually detection is only the first step in TB care and treatment. I think that absolutely necessary for bringing a national TB response is to have a social dialogue, and this is where the role of civil society is absolutely fundamental. Civil society can be this catalyzer that brings primary health care, social service, local public authorities under the same umbrella, because only working together and as we mentioned in our article for the campaign, only joining efforts we can make a change in the country. For this, it's absolutely necessary, and bold policy. I would say that this disposition is actually one of a good example that can be made available as a good instrument in catalyzing the interventions, even through these difficult times of pandemic. Absolutely necessary is to accept that the situation is different even in our country, and it differs from the district to district. Even the country is small, the interventions are absolutely adapted locally, and I would at the end of the presentation we would like to underline some of our best practices, which shows that different districts accept different ways to move on, but to bring and to achieve the target. Therefore, I would say that TB care and control should absolutely extend beyond just medical therapy. We should understand that civil society and community members do play a crucial role in TB response, and for this we should effectively explore all the opportunities for civil society and community organizations. We need to provide support for this, because that's part of the people-centered care approach. Communication, that's one of the key words in the process of trying to reach a target. Strengthening and creating motivation and support mechanism for providers, and I'm not referring only for providers of civil society, but as well as primary health cares and local public authorities. it is something that we still need to address. Just to finish with some quotation from an assessment that it's very close to my heart, and I would like to just to read it. TB care and treatment should be as effective as tolerable and as accessible for people and their families. People with TB as well deserve to feel respected and validated because they bear the heavy burden of TB treatment, from which the health of the entire community and nation benefits. So thank you so much. And here I will give the floor again to Tatiana. Thanks.
Thank you, Oksana, very much for interesting presentation. And I invite for the next presentation Alla Yetsko from the Union for HIV Prevention and Harm Reduction. Alla.
Thank you,
Yes.
Tatiana. Can you hear me?
Yes, we hear you.
Thank you. So I am happy to say hello to you, dear colleagues, and also to express my gratitude for the organizer of this session for the opportunity of participation in it. So I represent the Union for HIV Prevention and Harm Reduction, and the Union is an advocacy platform acting for sustainability, quality, and accessibility of harm reduction services or HIV prevention services among vulnerable groups in the Republic of Moldova. In the same time, Union is a service provider organization, and we are working for and with drug users, sex workers, people living with HIV, patients with tuberculosis from these groups. Our main approaches are peer support and specialized care. If you speak about peer support, about 75% of our employees are peer consultant. And we speak about specialized care, specialized support. We made it by cooptation and cooperation with medical, social, legal consultants and institutions in order to cover the important needs of people were our beneficiaries. Next slide, please. So just in a few sentences, I would like you to know more about Belts from epidemiological perspective. So Belts is the first city in Moldova that faced the problem of injecting drug use. The city has the heaviest burden of HIV epidemic, which is estimated with 6,000 of people living with HIV. 1,300 is the cumulative number of reported cases. It is important to mention that we have a high prevalence, HIV prevalence among vulnerable groups, risk groups, but it decreased from 40% in 2010 to 15% in this year, 2020. Also, Belts is in Belts we can find the high epidemiological rates of TB. It is the higher than in Moldova as well. The city registered the highest burden of HIV TB co-infection. So co-infection, TB HIV co-infection in Belts registered a 5-fold increase comparing to the rest of the country. HIV prevalence in TB cases is more than 37%. Addiction prevalence more than 30%. And I will mention that in the first half of 2020, 8 TB patients died and 6 of them were with HIV. So we can see a close connection between TB and HIV, and that's the reason that we we use the tools of harm reduction also to fight TB problems. In 2018, we did an analysis which showed us that in Belts, one person become infected with HIV every week, and every 3 days, one person gets sick with tuberculosis. So you can make some conclusions about it, about the situation. Thank you. Next slide, please. So in line with the international strategies, of course, we are trying to get, and we still aspire to get 0 new cases of HIV infection, zero deaths from HIV infections, 0 deaths from TB among people living with HIV and vulnerable communities. Probably at this time, TB along with HIV is the main focus of harm reduction project we implement, and also of the main focus of all our support and care programs. Thank you. Next one. So in order to achieve these targets, we are implementing the strategy TB HIV test and treat. It is a well-known strategy, and we are implementing the following interventions: early detection and diagnosis of TB and HIV, together with applying innovative approaches for testing key populations through rapid tests, for example, or through TB screening questionnaire. Also, we implement immediate start of, and we recommend, and we try to apply and to get closer to this task and to implement this intervention, immediate start of both therapies. And we are achieving this through a strong collaboration with medical institutions here in Belts. Implementing preventive treatment for people living with HIV and TB HIV. And we are speaking here, promoting and implementing PrEP and isoniazid prophylaxis. Promotion of different models of service integration at all levels, and I will speak about this in the next slide. Collaboration and multidisciplinary work, it's the key of success, I think, in every in each activity. And active involvement of affected communities in TB HIV programs, of course. They are important, and we are together a team, and we fight together for the rights, for the quality services and access to services. So in achieve the targets, we are using 2 complementary models of integration of TB HIV services. And if to speak about the first type of model, it's integration of services. Thank you, Tatiana. It's integration of services by bringing the services closer, even through reduction of physical distances, or by placing the services in a single structure. And I will give some examples, mentioning the following ones. TB screening for all clients of harm reduction projects. At least once in year, each harm reduction beneficiary will go through a tuberculosis screening. Provision of isoniazid prophylaxis within the framework of narcologist office. For, of course, for HIV positive clients of this office. Provision of opioid substitution therapy within the TB hospital. Provision of DOT by social workers of harm reduction projects. And we know that pills for tuberculosis every day are like clean syringes every day. It helps the people to stay healthy. Also, we integrate in our work measures to screen other health problems like blood pressure, blood sugar, so other interventions that we can implement. So the second model we implement, the second complementary model, it's integration through cooperation, development and application of efficient referral and follow-up mechanisms. And just a few examples, we are working together, and this is the most important thing within a disciplinary team involving, based on case management, involving pediatrician, infection diseases specialists, narcologists, and social assistants. And also together, we managed to have a green corridors for our social workers from NGO when they refer or go with the vulnerable groups for diagnosis or treatment initiation. Thank you. Tatiana, next slide. Now I want to introduce you Dima, a TB patient with his story. You can read it, but I will read it in the same time. So probably I would not have been alive if not this organization. It's about organization I represent. They saved me from an overdose twice and also from tuberculosis. After the hospital, Yura, one of my colleagues, the social worker carried pills to him every day for almost a whole year to Vysranka, a region that is really hard to reach, and it is not convenient. I have HIV for 12 years now, and I have been using drugs, but I'm sure that I have not infected anyone during this time, because now I know how to protect myself and others, using a condom and a clean syringe each time, going to visit to the doctor together with the social worker, so I can be examined for tuberculosis once a year. Now I can receive the treatment for hepatitis. So it is the history of Dima, and we have such a lot of such kind of stories. Thank you. Next one. Of course, in our work, we faced a lot of problems and difficulties, and I will mention just the most important in the context of COVID time. Like stigma and discrimination of vulnerable groups in the context of HIV. So still, drug users still are considered criminals and delinquents. And this influenced the opportunity of TB detection, not just of TB detection, but also of detection of other health problems. But this situation raised the barriers. A lack of connection between these groups and primary health care, and we know about what I am speaking now. So drug users, they are not very happy to go to a family doctor, and they don't know about whom is and where is located, are located their doctors. The medically uninsured status of the people from this group, especially I will speak about drug users. Lack of clear mechanism for confidential data transmission between institutions and services is a problem, and it can become a topic for a whole presentation, entire presentation. COVID-19 pandemic, of course, we know, and we will and we show through this presentation and in the frame of this session that it raised a lot of barriers in accessing TB diagnosis and TB services for vulnerable groups in the context of HIV infection, and not just for drug users, but also for sex workers and other groups. So it's all that I want to say and to present today. Thank you.
Thank you, Ala, for your very comprehensive presentation. And I invite Liliana for the next presentation. Liliana, you are with us?
Sure. Can you hear me?
Yes, thank you. You have the floor.
Okay, I have very rarefied slides. I'll talk more. Yeah, I'll present the activity of the organization that I represent in municipality of Chisinau. It's the biggest city of Moldova, is the capital city. It's about active case finding among homeless people. Shortly, I will explain about our organization. Our mission is to build bridges between extremely vulnerable populations affected by TB and HIV and existent services, medical services and social services in the society. We think it's necessary to build bridges because so many people don't have access to what our society has because extreme stigma, because extremely difficult situation, economical situation and social situation that they are facing. Let's go to the other slide. So we build these bridges between by means of implementing innovative projects, by mobilizing communities, and our most important projects that I would like to mention during all these years, during about 20 years actually, are DOTS in prisons of Moldova. So we were the first organization trying to implement DOTS strategy in Moldova. Incentives and enablers for TB treatment adherence in Moldova. It's still running actually with the support of Global Fund. And I mentioned this project here because we managed to start quite early, somewhere in 2006, 2007, to provide money incentives and enablers by breaking the tradition to distribute food or food tickets. And we demonstrated that actually it has almost the same efficiency as traditional incentives and enablers. We started to pilot virtually supported treatment of TB in Moldova in 2016 through a randomized control trial, and we together with some very important partners, and we managed to prove the efficiency of this tool to monitor treatment adherence. We are implementing a project to provide harm reduction services among sex workers. It's not an innovation actually, but I think we did a good job last year because we managed to elaborate a way to visit sex workers in their premises, in the apartments where they are that are rented by sex workers to provide services. I think that was considered quite difficult up to now. And we do active case funding among homeless people since 2013, I think, with good results. We were mentioned in the compendium of best practices by WHO Europe in 2016 with this project. So overall, we have about 3,000 beneficiaries per year that are helped by API to access services offered by our systems. Next slide, please. We also do advocacy and community mobilization to the extent that we can. We managed to mobilize several CSOs in 2013 to found the platform of CSOs active in the fight against TB. We are represented in the on national level in the national CCM, and we express the voice of these CSOs. Thank you. Next slide. So I will talk more in depth about case finding among homeless persons in Chisinau municipality. So we started to prepare this project in 2012. We did it by having a period of documentation and preparation. We were doing field visits in order to understand the specific of this group of population in our municipality. Our project covers about 50% of homeless persons in Chisinau area, which is about 1,500. While the estimations of the whole population of this of the whole homeless population in our town is estimated up to 3,000 persons. The services that we are providing are symptom screening of homeless persons for tuberculosis, then suspects or persons with symptoms are referred, transported to the medical institution that is providing TB testing and treatment subsequently. This project is impossible to be implemented without the support of medical structures and institutions, without the support of National TB Program, family health care services, municipal TB hospital. So basically our operation scheme is as follows. We have a mobile team that is running around the town, including 2 medical specialists and 1 driver. Basically, they are approaching homeless people in places where they usually spend their time, and we are applying the questionnaire, symptom screening questionnaire that has about 9 questions. In case of presence of at least 2 symptoms for tuberculosis, we are inviting the person to TB testing. Next slide, please. Our objectives, yearly objectives, are as follows. We want to cover 1,500 persons with symptom screening. We also test at least 300 homeless people for HIV and syphilis. And we want to ensure 80% of TB treatment adherence among homeless people put on treatment in Chisinau municipality. Let's go further. Our results in 2019 were, as you see on the screen, 1,529 persons screened, 42 persons detected with TB among them. We tested 300 persons for HIV. We detected 3 persons as a result, and 7 persons with syphilis. We supported with directly observed treatment 30 patients. Let's go further. yeah, it was my last slide, and I want to mention that during COVID times, we managed to obtain more financing from the Global Fund for the effort of active case finding. And if previously, in previous years, we were doing screening of homeless people once per year, symptom screening, now we want to cover as much as possible through through X-ray screening. And I must tell you that we already have better results in terms of detection, because it's a extremely affected population by TB. So obviously, if we want to have better results in TB screening among homeless people, it is better to have X-ray among them. And I think it's better to have even twice a year X-ray screening among this kind of extremely vulnerable population for TB. Yeah.
Thank you, Lilian, and thank you to all the speakers for the great interventions and for the great experience shared here with us. In conclusion, we see that the partners at the national level, at the local levels, together, the governmental and non-governmental partners put their efforts together to ensure the continuity of services and to ensure that the barriers to timely diagnostic for people who are suspected to have TB are removed timely, and those people have the support to ensuring their right to timely diagnostic. So we saw how the organizations of civil society in Moldova reorganized their work, and they focused more on community-based outreach supportive services. They started to deliver the TB treatment to patients at home. New innovative tools were launched, and also protection equipment and reagents were distributed. It was ensured that the people who needs some services receive them and are assisted in these, transported to the health facilities, and so on. Thank you for such good thoughts shared here, and I'm inviting now our attendees to raise their questions, if any, in order our colleagues can develop more on what has been done, and maybe share some other experiences that couldn't be covered during the allocated time. Thank you. So is anyone wishing to address questions to our speakers? In order to not take the time, and while the attendees are digesting, let's say, the information they received here, I would like to address a question to Lucia. If Lucia can answer to this, and if the question is, how do you see from your perspective of NGO, and also from your perspective of organization that is doing the management of several grants, and also providing coaching to the civil society partners. How do you see the CSO involvement in helping the frontline workers during the COVID times in order to ensure the continuity of services? Was this done? How the relationship between the CSO partners and the health staff evolved in a good or not so good way? Lucia, if you can share your thoughts with us, please.
Thank you, Christina. Do you hear me? Yeah. Thank you. I think CSOs can and should step in, support home-based treatment, DOT or VOT, can contribute to transportation of the beneficiaries, contribute to information, and other activities that can contribute to decongestion of the healthcare services. And about the relationship, I think they evolved enough, and we will evolve in the future too.
Okay, thank you, Lucia. So if anyone from the attendees has a question, please write in the chat Q&A, and we will allow you to speak aloud and ask your question. For now, I do not see any issues raised and any feedback in the Q&A box. So I know Tatiana had some questions. Maybe you addressed meanwhile.
Yes, I have a question for Ala. Ala, please tell me, how do you collaborate with the local public authorities in the context of the specific activities you implement? Thank you.
Thank you, Tatiana. So I know that in small cities or in not very large cities is easier to develop good cooperations, and such a good collaboration with local authorities we have here in Belts for a long time, because we are very actively involved in the implementation of a municipal program of TB and HIV prevention and control. Usually we have a jointly developed action plan, and at the same time we benefit from some financial support from the municipal budget for HIV activities. And of course, also, so these funds contribute to TB detection in vulnerable groups. So in 2018, we received 90,000 lei, Moldovan lei in 2018, and in 2019, we received from municipal budget 300,000 of Moldovan lei. Thank you. You're very short.
Thank you, Ala.
Okay, so while I do not see yet questions from the attendees, I probably will ask Lilian if he can tell us more on how their team or AFI team adjusted to the new reality. Did they faced any challenges, any barriers in conducting their work in field? As far as I know, they already have been involved in field activities since some years ago, more than 7 years, if I remember correctly. So which were the challenges your team faced maybe during this new reality? If you can share your
well,
concerns.
you know, the homeless people group has a very wide range of problems. Usually they solve their own problems by accessing different resources that the society is providing. For example, soup kitchens or free clothing provided by population. Beside that, there are NGOs that are working targeted with this group, as AFI does. And since we start, since the quarantine situation started in Moldova, the access to these resources due to retention measures became very difficult for homeless people. For example, marketplaces were closed, collection of clothing was not running so well, institutions were closed. So homeless people were facing an extremely difficult situation due to these retention measures, closing measures. We started to work together with a group of activists to, for example, that decided to collect food and to distribute to homeless people in Chisinau as much as possible during these very restrictive times. We helped them to establish routes, to have first connection with homeless people. We started to work more intensively with homeless people during COVID times in terms of TB detection as well. And I think this group of population faces extremely big problems because of stigma as well. Our population is not seeing them with much of empathy. They are considered usually, former people. And it's very difficult to mobilize resources for them. I think next year we'll have to have a very precise and very thorough plan for further TB screening of them and for finding measures to offer for them more medical services, because our medical network is overloaded by COVID now. So so this is the situation. We also participate and we also were always collecting clothing for them. Through our social network, we decided to collect clothing because our mobile team is, providing TB screening, and we can distribute clothing as well during winter times, blankets, food as well.
Thank you, Lilian, for this answer, and thank you for the job, the great job you are doing with your team and helping those in need, not only now, but it was done many years, and you are continuing even with the restrictions we are currently facing, and you are trying to ensure that the most vulnerable and the most in need populations still receive the vital help that is necessary for them to survive, let's say. Tatiana, do you have any other questions that you would like to address?
If our attendees didn't have questions, I have one for Oksana. Please, what activities beyond active case finding is the SMIT team engaged in? Thank you.
Thank you, Tatiana, for the question. Yeah, I would like just to mention that, of course, active case finding is one a very important focus for our organization, especially in this situation with coronavirus pandemic. Still, we have another a couple of very good experiences lately, and I would like absolutely to highlight the experience our organization is facing right now in implementing the TBREP regional project. Actually, we've been the country implementer since 2016, and we do see the progress in the bringing the people-centered care approach and trying to make TB services starting from the prevention, which is active case finding, and finishing with the support and care for people affected even after the treatment is ended, is absolutely crucial. One of the biggest achievements in the country was made a couple of years ago by developing the country roadmap for bringing and introducing the people-centered approach in TB care. When we are speaking about our new national TB program, which is going to start starting with the next year, we can absolutely affirm that people-centered care model is absolutely mentioned everywhere throughout the document, and this is a key achievement for the country to accept the idea that people affected by TB, including his family, should be and is in the center of the treatment process. Another experience we are doing, because every project we are implementing is actually an experience and an opportunity for our organization to get more and more knowledge about things which are going all around the world, and community engagement in research and development in Moldova is as well another good opportunity and absolutely new experience, because until STREAM and XENIX clinical trials, which are rolled out now in the country, there was nowhere and never before mentioning that community should be a partner in such a difficult process, which is research and development. And having implementing these two projects is absolutely crucial, because it gives the opportunity and tries to bring the perspective again of the people who are affected, of the trial participants, into the way that a study or a clinical trial is implemented. In this way, we achieved and we came with an agreement that starting with the next year, we will have a place for a community representative in the National Committee of Ethics of the Institute. And this is, again, one great achievement for communities to be part of a very dynamic processes of building knowledge, participating in collecting evidences for making the treatment regimens for people affected by TB more and more efficient with every year. That's it. Thank you.
Thank you, Oksana, and I would like to thank for the work Smith is doing, and also you stressed during your presentation that unfortunately the knowledge on people-centered model of care at the primary health care service is a bit suffering, and the staff is not receiving maybe timely training. So I would like to thank Smith for the activities you are doing in supporting the NTP, in conducting some trainings now online for the primary healthcare staff. And also I would like to mention the involvement of the civil society in Moldova in promoting the sustainability of the services, and in initiating the dialogue at the country level with the financing agency of the health services in Moldova for further sustaining the activities which NGOs are providing by state funding. So here I would like also to thank those who helped us in doing the activities we talked today about, and also who provided some information, and who are working also in territories, those NGOs that couldn't attend today, Casa Speranțelor from Soroca, Asociația Psihologilor Tighina from Căușeni, and Speranța Terei from Belts, the branch Afia Aneni Noi from Aneni Noi. And also we would like to thank for the great support the National TB Control Program hosted by the Institute of Physiopneumology, and those partners at the national level who are supporting us as civil society partners always, and are guiding us and make us confident in our efforts, and in the fact that together we can eliminate TB one day. Thank you.